Acid reflux is when stomach acid gets pushed up into the esophagus, which is the tube that carries food and drink from the mouth to the stomach. Some acid reflux is totally normal and harmless, usually causing no signs of sickness. But when it happens too often, it burns the inside of the esophagus. 14 to 20% of all adults in the US have acid reflux in some form or another. The most common signs of acid reflux is known as heartburn, which is a painful, burning feeling in the chest or throat. Scientists guess that around 7% of Americans experience heartburn daily. Of those who regularly experience heartburn, 20 to 40% have issues with gastroesophageal stomach acid pain disease, GERD, which is the most serious form of acid reflux. GERD is the most common digestive sickness in the US. In addition to heartburn, common signs of acid reflux include an acid-like taste at the back of the mouth and difficulty swallowing. Other signs of sickness include a cough, breathing disease, tooth wearing away and swelling in the sinuses. 1. Don't overeat. Where the esophagus opens into the stomach, there is a ring-like muscle known as the lower esophageal sphincter. It acts as a valve and is supposed to prevent the acid-like contents of the stomach from going up into the esophagus. It naturally opens when you swallow, burp, or vomit. Otherwise, it should stay closed. In people with acid reflux, this muscle is weakened. Acid reflux can also happen when there is too much pressure on the muscle, causing acid to squeeze through the opening. Of course, most acid reflux signs of sickness happen after a meal. It also seems that larger meals may worsen acid reflux signs of sickness. One step that will help acid reflux is to avoid eating large meals. 2. Chew gum. A few studies show that chewing gum reduces how much acid is in the esophagus. Gum that contains bicarbonate appears to be especially effective. These findings show that chewing gum, and the connected increase in saliva production, may help clear the esophagus of acid. However, it probably doesn't reduce the acid reflux itself. 3. Don't drink too much citrus juice. In a study of 400 GERD patients, 72% reported that orange or grapefruit juice worsened their acid reflux signs of sickness. How much acid is in citrus fruits doesn't appear to be the only factor adding to these effects. Orange juice with a neutral pH also appears to irritate signs of sickness. Since citrus juice doesn't weaken the lower esophageal sphincter, it is likely that some of its parts irritate the lining of the esophagus. While citrus juice probably doesn't cause acid reflux, it can make your heartburn worse. 4. Lift up your head in bed. Some people experience acid reflux signs of sickness during the night. This may disrupt their sleep quality and make it hard for them to fall asleep. One study showed that patients who raised the head of their bed had significantly fewer acid reflux episodes and signs of sickness, compared to those who slept without any elevation. Also, an analysis of controlled studies decided that raising up the head of the bed is an effective way to reduce acid reflux signs of sickness and heartburn at night. 5. Don't sleep on your right side. Studies show that sleeping on your right side may worsen acid reflux signs of sickness at night. The reason is not completely clear, but is possibly explained by body structure. The esophagus enters the right side of the stomach. As a result, the lower esophageal sphincter sits above the level of stomach acid when you sleep on your left side. When you lay on your right side, stomach acid covers the lower esophageal sphincter. This raises the risk of acid leaking through it and causing acid reflux. Obviously, this recommendation may not be practical, since most people change their position while they sleep. Yet resting on your left side might make you more comfortable as you fall asleep. For more at-home remedies, check out Natural Home Cures.